Good afternoon, everybody. Thank you for joining us for our press briefing on what the state is doing to respond to the pandemic here in our state and slowing the spread of coronavirus. As you can see, we've got a little bit of a different setup here today. The lights are turned down because we've got a PowerPoint presentation, and we're going to go through what we are doing with regard to the CARES Act and how we're going to be taking that money to help recover from this pandemic. Before we do that, again, I just want to remind people that we still, through the end of the month, have our 10-person rule in effect. We want people to keep that 6-foot social distancing. When you go out in public, it's always a good idea to wear a mask. Wash your hands frequently. You know, all that good hygiene stuff we've been talking about, all the good social distancing stuff. Please continue to follow those rules. We have less loosened restrictions starting June 1st, but that's not till next week, so please keep that in mind. Hospital data. 44% of our hospital beds are available, 43% of our ICU beds are available, and 77% of our ventilator beds are available. So again, we continue to have stable hospital beds here in the state of Nebraska, which is the point of all of the things we're doing to be able to slow the spread of the virus. So thank you very much to all the Nebraskans who have been working to be able to follow our guidelines and slow the spread of the virus. Another one of the things we do to slow the spread of the virus is test people to make sure that we find folks who have been infected with coronavirus, get them to isolate or quarantine, go back in their contacts. We do this for a variety of ways. TestNebraska.com is one of them. We encourage people to sign up for that. We've got over 150,000 people who have signed up for TestNebraska.com. We're doing testing in Omaha, Lincoln, Hastings, York, Beatrice, Kearney, and Seward this week. So we've already done Clay Center, so we're continuing to move around the state. Please sign up for testnebraska.com. And again, just to highlight that throughout the course of the month, up to this point, we've more than doubled the number of tests we have done in the state of Nebraska just in May, even before we've reached the end of the month, than we did in March and April combined. So we really have ramped up testing here in the state of Nebraska, including all the different aspects, whether it's the public health lab, Nebraska Medicine, our commercial labs, Test Nebraska, all that's contributed to making sure that we have more testing available in the state of Nebraska. Now, again, kind of our main show today, though, is talking about the CARES Act money. So what I want to do, though, is start by just briefing everybody on what has happened already with regard to the federal government. So, Lucas, if you could take us to our first slide. So the federal legislation has involved a number of different laws that have been passed. You've got the first one, the Coronavirus Preparedness Response Act for $8.3 billion. We've got our Families First Act, which is $2.4 billion. Of course, the CARES Act itself, the big bill, $2.2 trillion, and the Paycheck Protection Program for $481 billion. So significant number of federal programs to be able to help respond to what's going on here in the country with regard to the pandemic. And if you look at how this has all been distributed, and some of these programs go directly to people, some of them we as a state act as a pass-through, but if you look at all the programs that have been passed to date, well, actually through May 19th, through a lot of the programs, if you include the stimulus checks that went out, that actually includes May 22nd, $10.8 billion have come to Nebraska. Just to put that in perspective, if you think about our overall state GDP as being maybe $114 to $120 billion, this is a significant part of our state GDP has been sent to the state of Nebraska to help recover from this pandemic. Next slide. So a variety of programs have been out there that help different groups to be able to respond to this. So I'm not going to go through and read all this, but you can see children and family, disabled folks, rural hospitals, mental health, all the different types of topics you can see here that are getting millions of dollars going to them. I'm going to also highlight this one down here, homelessness and housing assistance. We got the question earlier the week with regard to helping folks who are having challenges with rent and so forth. $10.4 million has already gone out in that homeless and housing assistance to folks, and we'll be talking more about that later as well. Direct to local providers, $9.4 million to our federally qualified community health care clinics, going to hospitals and doctors, another $497 million. Hospitals got preparedness dollars up to $1.3 million. So a lot of, again, funding flowing to directly our healthcare organizations and individual doctors as well. Paycheck Protection Program. Obviously, Nebraska was one of the states that did very well in this. Our great relationship between community bankers and our small businesses and how hard our bankers worked to be able to apply through the SBA to get it allowed Nebraska to be one of the top states as far as percentage of payroll that was eligible being covered, over 80%. $6.4 billion to be able to help keep people employed here in the state of Nebraska. They also had a program, an emergency loan program, $122 million, just an extension of a $10,000 extension, $53 million. So again, money just going out that way. And so it's just a lot of stuff here in this economic impact payments. Again, this is the $1.6 billion we talked about, that stimulus money. The next one, unemployment insurance. And we all know that we've had 120,000 claims, 3 years worth within the last 3 years, or in the last 2 months rather. And so this is how that's going out. If you look at that federal pandemic unemployment compensation program, that $600 per week program we've talked about, $225 million has been distributed out through that. Also, if folks had previously expired or used up all their 26 weeks of unemployment previously, they were extended 13 weeks. That's part of this. And of course, we in the Department of Labor have received some money to be able to help staff up and respond to the increased business that we've got here through the unemployment insurance program. And then, of course, we've got a variety of other miscellaneous funds out there that are going out to different groups or organizations, whether it's transit, airports, election security, libraries. I'll just kind of point out the Department of Justice Byrne JAG grants. Again, this is money that part of the money is acted as a pass-through from the state, goes to the Crime Commission, and then we distribute it out to local law enforcement. Some of the money goes out directly to correctional facilities. And then on the next page, we've got our community development block grants, which the Department of Economic Development is working on a grant application process to be able to distribute those dollars as well to communities. We also have seen a benefit from the FMAP change. So the federal government changed the FMAP so that it will benefit the state of Nebraska about $70 million. We think that it will take about $40 million to cover the people that, for example, as part of that, we're going to continue the coverage for everyone, as part of this. If you were on Medicaid, for example, continue that coverage. Nobody's going to be kicked off of Medicaid or anything like that. So this money is used to help cover that. We've also asked for some waivers with regard to age and disabled and developmental disability, so additional money coming to the state through those programs as well. So a fair amount of money, millions of dollars coming to the state through the federal programs there with regard to health and human services. We also have an education stabilization fund. $151 million coming to the state of Nebraska out of the $30 billion that the federal government passed. So it breaks out to nearly $70 million for higher education, over $65 million for elementary and secondary education, and then a governor's fund for $16.4 million. So if we go to the next slide. So you can see this is how higher education is breaking out. For example, University of Nebraska getting $31.6 million. Other institutions as well getting coverage. You've got money down here for the secondary and primary K through 12 education. The $6.5 million is the part of the Department of Education. We'll be working on their plan for it, and we're coordinating with them with regard to that. So we're not here today to talk about the specifics of this education fund. We'll have an announcement later on with regard to that. But just want to make people aware about the money that's going to education. And specifically, what we're thinking about for the Governor's Emergency Fund is closing that digital divide. So this is one of the priorities from the U.S. Department of Education, is to address this. And so we are going to be really taking their guidelines or taking their guidance with regard to thinking about what we can do at the state of Nebraska to close that digital divide, whether it's devices or connectivity and so forth. We'll be having an announcement later to get into the details of this, but just to share with you what we're thinking about with regard to how the Governor's Fund will be spent to be able to address education. So now, getting into the Coronavirus Relief Fund. Every state got a minimum of $1.25 billion. That's what Nebraska got as well, $1.25 billion. If you had a local government that had 500,000 people or more, that local piece, that government got a piece of the $1.25 billion. And so Douglas County qualifies for that money. They got $166 million of the $1.25 billion. That leaves approximately $1,084 million for the state. So that is what we're talking about here, that $1,084 84 million is what we're talking about with regard to the distribution of this CARES Act money, and what our plan is to distribute that. So high level, starting off with state and local governments, about $180 million in aid to state and local governments to cover their costs of fighting the pandemic. We're going to create through the Department of Health and Human Services, CEO Danette Smith is going to create a community cares program for $85 million. For really business and economic recovery, we're looking at $392 million through a variety of different programs, which we're going to go into a little bit more detail. And then $427 million for our unemployment insurance program. Now, even with the federal government, for example, covering the federal pandemic unemployment assistance program and so forth, their aspect of it, the $600 a week, for example, we are still using money out of our unemployment insurance fund to be able to cover the regular unemployment that is going on here in the state of Nebraska. So, and for the folks in the room, don't worry about having to write all these things down. We will give you a handout at the end that covers all this stuff. So Fred, I see you diligently writing things down. We'll get you something, don't worry. So, but anyway, so $427 million to basically make sure that fund continues to be robust. We had the 6th best fund in the country as far as unemployment stabilization, having a stable, robust, funded unemployment insurance program before the pandemic started. And we have been, testing that. And so we're setting aside money to make sure that that fund continues to remain robust. So let's get into this a little bit more detail. Let's start with state government, $80 million. So again, what we're looking at is covering things that are going to be coronavirus related. Specifically talking about, expenses with regard to PPE, if you got to do telework, if you got to buy devices for people so they can do telework, if you got to have overtime, emergency temporary staff, you name it. If there's something that is going to be related back to how we're responding at the state level to cover it, that's what we're planning on covering. So one of the things that the Treasurer Mnuchin said is that you could be presumptive with regard to this, but then his staff in a later call had kind of walked that back to really be specifically focusing on the issues that are directly related to fighting coronavirus here in the state. So that's what the approach we're taking. We're taking a conservative response as far as making sure that we're looking at expenses that were specifically tied to fighting coronavirus here in Nebraska. Also, what was very clear from the CARES Act is this was not to be used to replace lost revenue. So we are being careful about this. We want to make sure that at some date in the future, there isn't an audit by the federal government that comes back and says, hey, this was not coronavirus related that you spent this money on, you owe that money back to the federal government. So we want to be very careful that what we're doing is not going to be able to be interpreted as something we'd owe the federal government money back. And we are looking to find a provider who is going to help us maintain all this as well. We don't have somebody lined up yet, but we will be looking to hire somebody who will help us manage all this and make sure we're doing all the proper tracking of all these expenses so that we can, again, go back and have an audit where we can justify all the expenses we made that were related to coronavirus. So state and local government, $100 million. Same sort of guidelines, though. From the standpoint, it's got to be with regard to PPE, buying sanitizers, sanitizing public spaces, emergency staff, you've got overtime, but all of it related back to the relationship to the coronavirus. Now, again, this gets back to, if you're thinking about local law enforcement, it will not cover things such as administration or detectives, things that would be paid for or budgeted ahead of time. However, if you have officers that were directly related to fighting the pandemic, then that would be an allowable expense. And so I've been talking for weeks to mayors of, from village boards all the way up to, Omaha, to keep track of their coronavirus specific related expenses, because that's what we will be looking to cover. Now, a couple of things here at the bottom of this slide. One is Douglas County got its own money. So all the local political entities in Douglas County will be taken care of by Douglas County's share, with the exception of the city of Omaha. So I've been in conversations with Douglas County Board, and we are talking about how between Douglas County and the pool of money they have, and the state and the pool of money we have, we will work together to cover Omaha's coronavirus-related expenses. So we're still in the process of working out all the details with regard to that. But Omaha will be the only exception to this rule that political entities in Douglas County will not be able to apply for the state dollars. So Douglas County and the state will work together with regard to Omaha. Douglas County will take care of everybody else in Douglas County. Also, if counties want to receive reimbursement for their coronavirus-related expenses, they will have to have their county courthouse, county offices open to the public on a non-appointment basis. So basically, business as usual by June 8th. So they will have to be open and functioning to be able to be eligible to receive a reimbursement for any coronavirus-related expenses. Okay, so let's talk about the Community Cares Act. Again, what we're looking to do is create a grant program, $25,000, to support existing services or programs that have been impacted by the coronavirus. Prioritizing people who are serving underserved or low-income communities, critical services, healthcare and so forth, and those organizations that are having difficulty in accessing funding. So we know that a lot of nonprofits, for example, are facing the same challenges as for-profits with regard to revenue. Those are the kind of folks that we're going to be looking at. So CEO Danette Smith will be working on the application process for that. Roughly speaking, the way we're thinking about how the money will go, will $20 million going to programs and community collaboratives, again, around food, housing, and so forth. I'm a big fan of community collaboratives. First Lady's, Bring Up Nebraska program with all the other folks who are working so hard to make that a success. One of the things I love about community collaboratives is they get nonprofits working together and they know their communities. And so they will best be able to address the issues in their communities because they'll have that local knowledge. Also, again, when we're talking about housing assistance, they do this all year round. And so part of their mission will be to, again, help people who are maybe having that difficulty with housing and need that housing. So this will be a pool of money that can be used for addressing that as well. Behavioral health, $5 million, again, important, especially at this time when people are asked to socially isolate and so forth, that distancing, all that. We want to make sure we've got resources available for behavioral health. We got in the providers and nonprofit emergency, again, those kind of services that we're talking about there, $40 million set aside for them. And then $20 million for shelter and housing. Again, this is the thing about homeless shelters. One of the things they do is they work with people to try to make sure they stay in their current home and not have to use the shelter. This is something they do all year round. So having somebody who's got that expertise is another way to be able to address that. So we got a couple of pools of money where that would be available through our Community Cares program. So let's get into how we're helping small businesses and that economic recovery here in the state. First of all, the total program will be $330 million. We're starting with small businesses, 5 to 49. And what we did is we thought about gaps. Where were there gaps where people were not getting money? So the Paycheck Protection program, for example, was a great program. We took advantage of it here in Nebraska. But there are small businesses that maybe weren't able to be able to get that loan because they didn't have the relationship with the bankers. The deadline passed, the money ran out, whatever it is. And from the work that Tony Goins had done, our Director of Economic Development, with his team that he put together to be able to evaluate what we need to do to get Nebraska growing again, he used the survey work also from UNO to be able to evaluate this so that we could say, okay, we think the people who are going to be the most impacted are going to be those small employers with 5 to 49 people. So we're targeting these grants at them. We also know that our number one industry here in the state is livestock. And so we want to make sure that we're taking care of our small livestock producers as well because they've been impacted. We certainly know about some of the issues with regard to where commodity prices are. We've seen what's happening in the food processing industry where we've had huge slowdowns, people not being able to get their animals to market. So again, looking at targeting those folks who've got the smallest operations, livestock producers between 1 and 10 people in beef, pork, dairy, and so forth, to be able to help them out. So we're targeting $12,000 grants to all qualified applicants. The Department of Economic Development is working on a program to be able to do that. We'll get into more details and have announcements later on with regard to how people will apply for these as well, but this is the way we're laying out the program for our small businesses and small livestock producers. Then, one of the things that we know we have an opportunity to improve upon is broadband access here in the state of Nebraska. One of the things we also know is this money has to be spent by December 30th. So we worked, again, Tony worked with people he was talking to in the industry, looking at, say, the rural broadband work, the Public Service Commission, all people who have an expertise in this area, talking to them about what could be possible. And this is how we came up with $40 million to be able to target communities of 1,000 to 5,000 people, where we typically have less than 2% of fiber going into the home, to be able to expand that broadband access. So, for example, paying for installation fees for people to get hooked up to broadband. This is going to be important not only for economic development, but also for education, to be able to make sure that those young people have access to be able to use that broadband and, do more distance learning. So we worked with telecom companies to come up with what would be possible, what could we get done, and so this is the program we came up with that we think we can actually push $40 million out the door to improve broadband services in our small towns and rural communities by the end of the year. Then we also wanted to address worker training. We've got we've got the opportunity here where we can take folks who maybe have been displaced by this pandemic. We know that we've got high unemployment right now, 8.3%, and get them retrained to be able to take a better job. Again, this all has to be done by the end of the year, so we want to hire some coaches or navigators, whatever you want to call them, use part of the money, about $2.4 million for that, and then give out grants to about 12,000 folks, to be able to get $1,100 per student each, to be able to primarily think about, again, community college type grants, somebody who wants to go to community college, upgrade their skills, get them the $1,100 so they can afford to be able to get that upgrade and take that better job. So that's our $16 million that we've got set aside for that. We also have $1 million set aside for Gallup to help them with small businesses. Many small businesses have had to retool their business model with regard to how they're responding in this pandemic. And so this will be a way that small businesses will be able to get access to some advice on how they can do that and relook at their business model to be more successful going forward. And then, of course, all of this is going to require administration, and so we've got $5 million set aside for administrative support in the Department of Economic Development to actually administer all these programs, to be able to get the grants out the door, to be able to help people get that education, help those folks be able to get connected to broadband and so forth. Okay, and then finally, the Unemployment Insurance Trust Fund, $427 million. And one of the things about this is that we don't know exactly what we will need for the Unemployment Insurance Trust Fund. It depends a lot on how quickly this recovery goes. So a lot of our investment that we're making through the Department of Economic Development will help mitigate what they need for having an Unemployment Insurance Trust Fund. But we're setting aside this $427 million to make sure that we are covered in that fund. And this also gives us a flexibility that if the federal government were to, say, pass a bill such as Congressman Don Bacon has introduced that would give state and local government more flexibility with regard to CARES Act money to be able to cover revenue losses, then we would be able to reevaluate whether all this money needs to go into the Unemployment Insurance Trust Fund, and maybe that gives us some flexibility to use it in a different way as well. So that's really, our primary purpose is the Unemployment Insurance Trust Fund, but really getting at that idea that if we don't need that and we do get some additional flexibility from the federal government with regard to the CARES Act, we've got some room to be able to maneuver with regard to that. And that is the end of the presentation. I've got a number of my directors here who are involved with regard to how this program is being administered. So we've got Tony Goins, our Director of Economic Development, Danette Smith, our CEO for the Department of Health and Human Services, Joe Bohack with regard to the National Guard. Again, this is emergency funding, so it's going through there. I've got Steve Wellman, our Department of Agriculture, Director of Department of Agriculture, and Jerry Oligmuller, who's our Budget Director. So if anybody has any specific questions for them or questions that I don't know the details, we can call one of them up to answer those. And of course, as always, Dr. Antone's here to answer specific health-related questions with regard to the pandemic. So, Taylor, we got questions. We're going to go with those first. First of all, Sarah Kirkley, NTV. President Trump has called Mail-in ballots substantially fraudulent. Is there any indication that there was fraud or forgery in Nebraska's primary where a record number of people mailed in their ballot? I spoke with the Secretary of State, and he said he's received no reports of fraud or forgery, but I certainly encourage people to reach out to the Secretary of State. That really is his area to monitor if you have any more questions with regard to that. And do you have any concerns that distrust in the early ballot process could impact Republican candidates in Nebraska, especially since some precincts in the state are mail-in only? I think distrust in the voting system impacts all voters, not just Republican voters or candidates, and impact everybody. And then should Twitter be fact-checking politicians? And that is really, Twitter's a private company. That is up to them to decide how they want to run their business model. So I would leave that, I would defer to Twitter on what they think they should be doing to be successful as a business. Bill Shammer, KOLN. With the CDC saying primary way the disease is transferred is through air, are you considering changing the rules for arcades, billiards, darts, and other common bar activities? And right now, we are not considering changing it. Those are all kind of activities where you're in close contact, potentially somebody could spread it that way. So for the time being, we're not going to be changing those rules. But again, this is a step-by-step process. We took our first step at the beginning of May for most of the counties in the state. We're taking another step here at the beginning of June. So we want to take this step-by-step to be able to make sure we continue to slow the spread of virus here in Nebraska and preserve our healthcare system. Any updates? Oh, and when I say preserve healthcare system, what I specifically mean is make sure that anybody who needs that hospital bed, ICU bed, or ventilator can get it when they need it. That's what we mean by preserving the healthcare system. Any updates on rules or guidelines for cheer and gymnastics, since they're listed under contact sports? And again, we'll continue to evaluate all those sports as we go forward. We're going to take this on a step-by-step basis. You've increased the capacity for daycare centers up to 15, allowed allowable groups up to 25, even okayed garage sales. In light of those, what does it say as to church ministries like Sunday school and small group Bible studies? Well, again, small group Bible studies would fall under the gatherings of 25 people, and we'll continue to review Sunday school. I don't know that people are in Sunday school right now, but we'll continue to review it. And this one, had the governor visited the Life Care Center or has any plans to visit? I have not visited the Life Care Center, and that's from Michelle Bandur, KETV. And folks, again, we're really encouraging people not to go visit those long-term care facilities. We're really trying to keep those folks away from other people so that we don't spread the virus. Taylor, did you have additional questions that were texted in?
Yeah, Don Walton would like to know, does the information we covered here prevent the need for major cuts to the state budget?
So Don Walton, Journal-Star, wants to know, did the information we provided here prevent the need for cuts to the state budget? Okay, folks, this is all CARES Act money. This was that federal program, that emergency money the federal government passed on to states. It does not relate to our general fund budget, so those are two separate things. So we will continue to monitor what our situation is with regard to revenues coming into the state. We really won't know or have a good idea on that until we get past July 15th when we get income tax revenues are due. Remember, that got moved from April 15th to July 15th by the federal government. So after July 15th, we'll have a better grasp on what's going to happen with regard to the state revenues. But that's a separate pool from what we're talking about here with regard to the federal budget. Anything else?
Don Walton also asked, Douglas County gets $166 million, while local governments, the other 92 counties share $100 million. Is there a good reason for that?
So the question was, Don Walton also asked, Douglas County gets $166 million. Other local governments are going to be splitting $100 million. And the reason, again, we're going to ask people to supply their coronavirus-related expenses. We think that $100 million is going to cover it. The $166 million was set by the federal government. We didn't have any input with regard to that.
Brian from WWT says that the state of Kansas is encouraging people who travel to the Lake of the Ozarks to voluntarily self-quarantine. Do you recommend the same for Nebraskans who were there last weekend?
So the question was, state of Kansas is recommending, from Brian from WWT, state of Kansas is recommending that people who went to the Lake of the Ozarks last weekend voluntarily quarantine if they come back to the state of Kansas. Actually, starting June 1st, we're saying that you don't have to do that. Certainly, though, if you were a Nebraskan who was down the Lake of the Ozarks and you felt like you were exposed to somebody, yes, you need to stay home. If you've got symptoms, stay home. If you're feeling sick, that fever, shortness of breath, cough, all that, you should be staying home and making sure that you're self-quarantining, but we're not putting in a requirement that everybody who went there has to do that.
Jose says, I
So Jose Cezallas says there's a Douglas County official that is saying they need to do more testing in Douglas County and looking to expand testing. And of course, we are doing that. That's part of our testnebraska.com effort, right? So please sign up for testnebraska.com. It's helping us expand testing. We're also looking at other ways to be able to expand testing, whether it's working with Nebraska Medicine or the Nebraska Public Health Lab or the commercial providers. We're continuing to look for other ways to be able to expand testing. And again, I'd highlight that through May so far, we've more than doubled the number of tests we've done in the state of Nebraska. We've actually doubled the number of tests in less than 1 month here in May than March and April combined. So we did about 27,500 tests through March and April, and we've more than doubled that amount in May already. So we are expanding testing here in the state.
And then finally, William Padmore wants to know, why are we requiring local courthouses to be open to receive reimbursement?
And then, William Padmore wants to know, why are we requiring local courthouses to be open to receive reimbursement? Look, folks, our job in government is to provide services. That's what we're supposed to be doing. We do it at the state. It needs to happen at the county level as well. If counties want to make a different choice, then we're going to reserve the money for counties who are going to be looking to serve the public in a full way.
That's all I got for now.
Great. All right, questions from the media here in the room?
This is a huge amount of government spending. How does it square with your limited government philosophy? Do you have any thoughts on that?
So Fred asks, hey, this is a huge amount of government spending. How does this align with my more conservative, small government type values? And I think that, whenever you have an emergency, it's always recognized that the government does more than when you have normal times. And so I think it's appropriate that when we have an emergency like a pandemic like this, which we haven't had in over 100 years, that the federal government takes steps to be able to make sure that we can protect ourselves and recover. And of course, when we have money that's coming to the state, it's also our responsibility to make sure that it is spent in an appropriate way for the citizens of Nebraska, that we're good stewards of those dollars. And that's what we're going to be doing with this program, is making sure that we're going to be good stewards of these dollars, that we're going to apply them. Again, we're looking for gaps where other federal dollars haven't been going, and trying to catch folks who maybe haven't been able to take advantage of other programs, to be able to make sure we can do the best job we can with regard to, again, keeping people safe and healthy and making sure that we get Nebraska growing again.
And does any of it require legislative approval, or is it just an executive decision?
So the question is, does any of this require legislative approval, or is this an executive decision? In fact, so I'm going to call up Jerry Oligmuller, who is going to talk about that in a little bit more detail. Jerry?
Okay, Jerry Oligmiller, State Budget Director. LB 294, which is the mainline appropriations bill, includes a provision that allows for the acceptance of federal receipts and automatically appropriates them in the specific amount they're provided by the federal government. I'd also point out that under the Emergency Management Act, when we're responding to a public health emergency and additional federal funds are allotted to the state of Nebraska, there's a provision for placing that in a separate account and using it in response to the public health emergency. So this is a sort of boilerplate language that exists in the mainline appropriations bill and has for a long time. It recognizes that there are events that from time to time result in the appropriation of additional federal money made available to the state when the legislature's not in session, and which happens to be the case. And in addition, very specific statute with regards to the Emergency Management Act and the governor's ability and the adjutant generals to carry out a response to public health emergencies.
So you already have the authority?
Yep.
Thank you, Jerry. Martha?
There's a group of state senators that have sent a letter to you asking that money be appropriated from this federal, that money from the federal government be used to help childcare providers who have been struggling to survive.
So Martha Stoddard of the World Herald said, hey, there's been a group of senators that sent you a letter saying help out childcare providers who are struggling. So we got a couple different programs. Actually, can you flip back, Lucas, to the CARES part? There we go. So we got money here. Again, if you'll notice, we're looking to do $25,000 grants for folks who can apply under the kind of programs that we've got here. Also, as small businesses, if they're small, so if they're nonprofits, they can leverage this. If they're small businesses, they can leverage the program that Director Goins is going to be doing with regard to the $12,000 grant there. So we've got a couple different ways that those child care providers can be taken care of. In addition, so we got a couple different ways through this money that we can help. Yeah, Lee.
I have a question for Tony, if that's all right.
Tony.
How do you...
Come up here, Tony.
So you've been able to work firsthand and see the impact that this has had on businesses all across the state. The money that's being appropriated, can you kind of talk to the lengths that that'll go and how that provides to help, kickstart the economy again?
Absolutely. Tony Goins, Director of Economic Development for the great state of Nebraska. That money is going to be huge for our small businesses. And let me say this in the sense that if you had cracks in your business system, it's not going to fix everything, but the ability to have funding to stimulate and help stabilize your business and then help you set a platform for growth is going to be huge for the state. You had the PPP, of course, which was used for payroll. But now you have an opportunity to expand use of that money for operational expenses, which could mean buying inventory, the things that will help you generate revenue. You could use it to help pay rent if your rent reprieve has been taken away. You can also use it to pay on loans. Now, if you had an SBA loan, that's been deferred for 6 months. If you had a typical bank loan, the banks have deferred those loans for up to 90 days. So that lever is still in place. But to answer your question, this is going to be a big deal for the state, especially for those small businesses that apply and receive the money.
I'm assuming there's been businesses that have started in the past 6 months, and this has just kind of been a deflate to their kickstart, to their dream of starting something up. What has it been like working with, you've got the round from top to bottom with big to small. What has it been working with that gamut of, the small businesses and trying to make them advance, and then you got your big companies that are trying to still make it go as well?
Well, I think it's a balanced conversation. I mean, our small businesses are the backbone of economic growth in the state of Nebraska. However, our large businesses employ a lot of citizens, and they pay taxes, and there's health care involved. So for me and my team, it's a balanced conversation. I mean, we treat all of our businesses as if they are of value to the state, because they are. Our large organizations, I mean, of course, that sometimes is a little more extensive and complicated conversation. But our small businesses, I mean, it's a very personal approach when it comes to our small businesses. Okay. Thank you.
Thank you, Tony.
So what percentage of the need does all this fill? I mean, from a 30,000-foot view, the state's getting $10.8 billion, that's like 10% of the GDP. Is that about the size of the hit that we've taken?
So the question was, what is the size of the hit we have taken here in Nebraska, and how does this stack up against the size of the hit? And I think, Fred, that's difficult to say what the complete impact is. We still don't know, because we haven't seen what the recovery is going to be like so far, right? We're still at the beginning part of when we know we got a record number of Nebraskans who are unemployed. Our job is now to figure out how can we slowly start taking those steps that will allow more people to return to a more normal life, and as a consequence of that, more people will start being able to go back to their jobs in a more normal fashion. So I don't know that we know the answer for that right now, but I think that what we've seen so far is it's been significant coming from the federal government. And again, we want to continue to try and find folks who can help out, and that's really what our Coronavirus Relief Fund is about, is looking for those folks who may need that additional help, like those small businesses who have 5 to 49 people, or those livestock producers have 1 to 10, or those nonprofit organizations that are having trouble raising money. We want to really make sure we're targeting those folks, because they're going to be important as part of the recovery. Yeah, Lee.
How far does this take us in terms of timeline, months, days, weeks, to the end of the year? How far do you see this getting us?
So the question is, how far does this take us? Well, it doesn't take us any further than the end of the year, because all the money that we got has to be spent by December 30th. So that's one of the restrictions in the bill, is it has to be around spending money to fight coronavirus, and it has to be spent by the end of the year. So we will get a better idea once the application process is open for those local governments. When they start responding back to us with regard to what their related expenses are, we'll get a better run rate on those expenses. When people start applying for the different programs, whether it's our community cares or our economic development, we'll get a better idea when we start seeing those applications roll in as far as what the need is going to be. But I guess the big takeaway is this money has to be spent in this calendar year.
I meant more like, what was the feedback from your directors in all of these different areas? I understand it has to be spent, but do you expect it to make it to the end of the year?
Again, the question is, do we expect this money to make it for the end of the year? And I would say, based upon what we're spending at the state, we would expect this to cover our expenses for the end of the year. And that's why I said we'll have to kind of wait to see when those local governments start supplying what their expenses are. That'll give us a better idea with regard to, what their expenses are going to be through the end of the year. And we'll have a better appreciation once we get those applications in. Martha.
You said that you were looking to hire somebody to keep track of this money. Is there some reason why your state employees are not able to do that?
So the question was, we're looking to hire a firm to be able to help manage this. Why wouldn't we do it at the state? This is going to be a big project. So think about it. It's over $1 billion. Our general fund budget is $4.5 to $5 billion. So it is going to be a big job to keep track of all this money. And of course, we're going to get audited on it, which means that we need to make sure that we can account for everything and then make sure we pass that audit so we don't owe the federal government any money. And all of our state teammates, guess what? They're busy with their day jobs right now. So this is really essentially thinking about taking on another 20 or 25% additional work. We need some additional help to be able to manage that. And so that's why we're looking to get an outside firm to be able to help make sure that we can manage this and do it in an appropriate way, that we can track all this so that the federal government so we can pass a future federal government audit.
How are you selecting that?
So General Boak, you want to come up and talk about the process? We're still in negotiations, talking with folks, but General, maybe you can talk about the process.
Thank you. Because of my responsibilities to the government, state government, for emergency management appropriations and this money flowing through those accounts. And I would just add, Governor, so as he said, our state employees are doing a regular day job. I would just remind everybody that we're still in the midst of recovery from the 2019 floods. And those costs are estimated to be for public assistance alone, over $400 million that will have to be adjudicated over time through the Federal Emergency Management Agency. So that work is still ongoing. The process, because we're under an emergency, we're able to use the emergency contract procedure to do a request for information from several firms. We received those. Those requests included statements of competency and how they would manage this process for us. So we're in the final stages of selection and solidifying that contract to be able to roll out a program very quickly here so we can move the money quickly to the various programs that were discussed by the governor. Yes.
Is that able to work retroactively in terms of that company being able to look back and do their job as well?
They can. Just as a reminder, it has to be. Oh, I'm sorry. The question was, can the company that's going to be used look back for previous expenses? And they can, but it has to be costs incurred 1 March or later, between 1 March and December 30th. So all costs COVID-19 activities related can be looked back. We're already providing funds to local public health departments. So for example, we've been doing that internally, but this is a process that would shift to that company and they can look back and help us with gaining the substantiating documentation, other things we need to survive an audit.
A couple things I just want to build on what the General said. So first of all, thank you, General, for reminding us about the recovery from last year's flood. So that over $400 million that in public assistance that we're working with local government entities to get responded to. So we've already got a big project on the table right now we were already responding to with regard to our state teammates, and another big project with this coming on top of it, which is another good reason for saying that we need to get some additional help. And then also, I can't remember if I talked about this earlier, but I did want to talk about the local public health units. We had said how we are looking for people to reimburse expenses, specifically regarding to fighting coronavirus. And I used the example of law enforcement. Local public health is generally run on grants, and so those grants don't cover this work with regard to the pandemic. And so what we are doing is we are reimbursing local public health departments for their salaries of people who are working on this. So that would be a little bit different from what we're doing for other organizations, but it's because they're structured a little bit differently. And of course, they're the front line on responding back to this pandemic. So we are actually covering their salaries for the people who are working in the local public health departments to be able to respond to the coronavirus.
It sounded like you were saying that the $166 million that goes to Douglas County is not going to be shared with Omaha, that they're going to get a separate pot of money, and if that's the case.
Okay, so, I'm sorry. So Fred asked a question about the $166 million and being shared with Omaha. Let me clarify. So Douglas County gets $166 million. Between that $166 million and our $1.84 billion from the state, we're going to work together to use those two pools of money on Omaha's coronavirus-related expenses. So part of that $166 million will go to Omaha. Part of our $1.84 billion will go to Omaha to be able to cover those expenses. So it'll come out of both pools of money.
And then it sounded like the 427 to the unemployment insurance trust fund was sort of going to be parked there pending whether or not the federal government gives you flexibility. And if they do, what then could it be used for?
So then the question was that $427 million, if you don't put that all into the unemployment insurance fund, and let me be clear, any money we put in that fund, we can't take back out. So we will put that in as we see the need to replace the dollars that we're losing there, or that we're spending there. So we won't put it all in at once. We'll put probably some in to cover expenses as we approach the end of the year. If the federal government, for example, gives us flexibility to cover lost revenue, that might be an example of how we could take some of that money, instead of putting it into the unemployment insurance fund, whatever we haven't put in there yet, we could use that to cover lost revenue for state government and local government. Martha?
So there's been discussion at the national level about whether to give more money to states and local governments to help with this. Would that be helpful for Nebraska to get additional appropriations from the federal government?
So the question was, should the federal government do another bailout package on top of what they've already done? And here in the state of Nebraska, at least at this point, I don't believe that would be necessary. I don't know that that is something that the cost is worth the benefit in that case. Because remember, when we go out and borrow trillions of dollars, it's our kids, grandkids, great-grandkids that are going to be paying all that back. And we already know that we've got a tremendous budget deficit already going on right now, and that our debt is skyrocketing as we add on more debt. I think that what Congressman Bacon has proposed is a great compromise. The money that has already been appropriated from the federal government gives states the flexibility to be able to fill revenue gaps if that's what they choose to do, as a kind of a compromise position versus having additional more rounds of spending. Yeah, Martha.
Nobody else jumps in.
Nobody else is jumping in.
On another topic, I've been noticing that the number of cases, and now we've had at least one death in Winnebago. Is the state doing anything to help that area, that tribe, cope?
So with regard to the Winnebago and just our Native American tribes in general, they are all getting separate, so they're all sovereign nations. They are all getting they have their own separate relationship with the federal government. And they have their own pool of money that they are receiving to respond to the pandemic. For example, they've received their own testing machine and so forth. So they are really responding to that. We have had conversations with regard to it. We've offered to supply them PPE, for example, if they were running short on that, that sort of things. So, but generally, the tribal nations since they have their own relationship with the federal government, are using, those resources to be able to respond.
Have they asked for any expertise or people to supplement what they're able to do?
So the question was, have they asked for any people or expertise to be able to supplement what they're doing? In general, I believe the answer to that is no. So I don't believe they've made any requests along those lines. Lee?
Looking back at the PowerPoint, not to pick favorites, but can you kind of look at some of the areas that you recognize to be the most important? I mean, I don't know how many slides, 15, 20 slides. What are some of the focal points that you want to make sure the public is aware of where money is going to be appropriated for those big questions you've been getting asked?
Well, again, I think all the aspects of the program are important. And so I don't think there's one that's more important or less important than the other. I did highlight the housing because we'd have been asked questions about that. So that's an area that I would highlight. And we talked a little bit about child care providers as well, because we'd received a letter from one of the state senators. But all the areas are important. I'd certainly highlight the Unemployment Insurance Trust Fund, because that's how we're meeting the needs for Nebraskans who are unemployed right now. And that's having a huge impact on families across the state, because we know there's a big need right there.
Time for just a couple more questions.
2 more questions. Martha?
Where do we stand as far as nursing home deaths?
The question was,
153 that we've got.
the question is, where do we stand with regard to fatalities in our nursing homes? And Dr. Antone, I'm going to call you up to answer that question. I do not know that off the top of my head.
So as far as nursing home deaths, we talked about this a couple times before. We have currently 74 confirmed validated deaths at nursing homes. So I think right now there's 15 deaths out of nursing homes that aren't validated. So if you look at our numbers today of 153 deaths and 74 confirmed deaths, right now it's close to 50% of our deaths are from long-term care facilities.
So the 15 would add to the 153.
It would.
If they were validated.
If they were validated, yes.
So the proportion of non-long-term care deaths has increased in the state.
Yeah.
It's actually just the opposite.
I think if,
No, because the proportion of nursing home deaths has,
Oh, I see what you're saying, got it.
it's
I think
lower
it-
than it was.
I think it was, yes. I think at one time we thought it was around 60%, so now it's closer to 50%. And that would even probably lower that percentage if those deaths were validated.
So is that a bad sign that you had talked the other day about it being, that one way to look at that was that it was a good sign that it was the more vulnerable people who were dying, not the people who.
Yeah, I think when I made that statement the other day about every death is a tragedy and every life is precious, but the fact that the most highest risk population is the one that is dying is actually a good statistic for Nebraska, which means we're actually protecting. But still, it's the majority of deaths are due to long-term care residents at this time, so.
Time for the last question.
All right, one last question. Nobody wants to take the last question? All right, folks. Well, hey, thank you very much for joining us here this afternoon with regard to what the state is doing to slow the spread of coronavirus here. Obviously, we've got a lot of work to do with regard to how we're going to be helping Nebraskans with our CARES Act money, and we look forward to continuing to roll out these programs and tell Nebraskans how they'll be able to apply with it. So please stay tuned with regard to all of that. Again, we will be back here for the next couple days, 2 p.m. Central Time. We've got my last town hall in NET, last scheduled one, tomorrow night at 8:30. We've got a Spanish language briefing at 5 p.m. tomorrow night Central Time. So catch us at those things, and if not, we'll see you back here tomorrow at 2 o'clock Central Time. Thank you all very much. Appreciate what everybody's doing, and we'll see you back here tomorrow.